Okay. Hi, everybody. I am getting ready to be joined by Dr. Dyan Hes, who is a pediatrician and obesity medicine expert, and she actually focuses her entire practice on childhood obesity. So she's going to join us tonight. And then should be, there we go. And then I don't know, for some reason your camera is sideways. Does it rotate?
Yep.
There you go. Yep. That's perfect. All right. And I'm just adjusting mine and putting mine in the holder. So good evening, everyone. Welcome again tonight for an Instagram live session. I am thrilled to have Dr. Dyan Hes with us tonight. Dr. Hes is an expert in childhood obesity. She is also one of the board of directors for the Board of Obesity Medicine, so she definitely knows what she is talking about. You're not going to really get much more of an expert in childhood obesity than one of the directors for the Obesity Medicine Board. So we're very excited for her to join us tonight. She's coming to us from New York City, where she has a busy clinical practice there, and really is focused on improving the health starting in our younger generation, because as we know, healthy kids eventually lead to healthy adults. And so that's probably the best place to start. Even though it's never too late to become healthy, if we can start in childhood, that's definitely going to put us ahead of the curve. So with that, thank you so much for joining us tonight.
Thank you for having me. I'm excited.
Yay. So I kind of told a little bit about yourself, but why don't you just give us a little bit more about your background and
Sure.
your practice?
Sure. So I'm a general pediatrician who decided to study pediatric obesity before it was known to be an epidemic. So I trained in the inner city in the Bronx at Montefiore Hospital, part of Albert Einstein, from 1997 to 2000. I did my residency there in pediatrics, and in our pediatric medical education, we learned about undernourished children with failure to thrive, who are often very thin and not growing. However, in our 3 years of pediatric residency, we never saw a child with failure to thrive, not once. What we did see were children who were being overfed and completely undernourished. So we actually saw a child who was obese but had rickets because the vitamin D was so low, because the mother was feeding that child chicken wings and apple juice every day. The child never got milk. So, and I just noticed a huge prevalence of kids in our clinic who were eating the wrong food. They were eating, spicy Cheetos and fruit punch in the baby bottle, being overfed huge volumes of formula. And I asked my program director, can I do a project on pediatric obesity? And he said yes, and it's been my career ever since.
No, that's really that raises several points, because I don't think sometimes parents or guardians recognize that, some of the foods that we're feeding to our children can actually impact their health. And so while it may seem intuitive to many people that a toddler probably shouldn't on a regular basis have things like Cheetos and chicken nuggets all the time and things like that, a lot of people, especially depending on what their circle's like, if their friends are feeding their kids similarly or things like that, it's kind of becomes this circle where everyone eats like that. So what's the problem? And,
Right.
And they don't realize it until they start having some outwardly signs.
Right. And like at one point I wanted to make a sign in our office that said, McDonald's is not a reward for getting your vaccines. So because every parent would say, like, if you're quiet for your shots, we'll go to McDonald's. If you're quiet, and I'm like,
right.
First, like, food should never be a reward. That's just setting up a whole other psychological problem. And people, I forgot to tell you this earlier, but people think that if they come to my house, like I'm this extreme parent, that my kids don't get sweets, and I am so not like that, because I grew up in a house where my mom was very restrictive about foods and snacks. And I think it caused a lot of eating issues with my sisters. And for some reason, I was more resilient and it didn't affect me. But I think everything in moderation, because if you restrict too much, also your kids rebel and they go with their friends and go crazy. Just like people who are, Yeah. So, you know, you can come to my house and find cookies, but my kids will also come home from school and say, "Oh my God, I can't wait. Do you have lentil soup?" You know, because that's how they were raised.
Yeah.
So it's about balance.
Right. And I think too, you bring up a good point. It's and we'll talk more probably about portion sizes and things like that. I think a big issue is too, from adults to children, kind of everywhere, that our definition of moderation is skewed. So, you know, and I feel like I hear that often from different people. They're like, well, I have to live my life and it's everything in moderation. And I
Right.
kind of always throw it back to them. I'm like, so is
That's
something that you have 2 to 4 times a week, is
right.
that really moderation? Or are we talking about once a month when you go out to eat and you're like, sure, because I hardly ever go out to eat on a regular basis. So you're going to enjoy yourself. So I think also
I
too,
never thought about that. That's really true.
yeah, getting on the same page about moderation, because a lot of times I'll hear people say, you know, yeah, I have it in moderation. When I dig deeper to see what moderation is, I'm like, okay,
Oops,
so
that's
like,
not really
like
moderation.
almost every night. So I'm like, that's kind of not what I had in mind. But you know, we need to discuss that more.
Right.
I think some times, so like for adults, you know, we talk about the BMI in terms of it being, you know, obesity greater than a BMI of 30, et cetera. But it is defined differently in children than it is in adults in terms of
Correct.
like percentiles. So would you mind, just for the audience, telling them how obesity is defined in children?
Right. So obesity is defined as your child being at or greater than the 95th percentile of the body mass index. So the body mass index helps physicians gauge how your child's growing compared to other children their age in the United States in the CDC, and that height. So we separate boys and girls. They have separate curves, and it goes from age 2 to 20, the curve. But by 18, you really can you could also map them on an adult BMI curve. So parents, you know, often get crazy when they hear the BMI because they don't understand it. And then you have to explain to them that it's not an exact science. It's just something quick and easy. And I'm not judging you, and I'm not judging you as a parent when I'm telling you this. And I know that in New York City, we tried to do BMI report cards, and it created like huge amount of hysteria because kids were being told they're underweight and kids were being told they're obese. And it was very emotional. The parents were getting this letter in the mail. But you know what? They meant it. It was a good discussion. It was a discussion starter. You called your pediatrician and your doctor and you said, can we discuss this BMI report card? So yes, maybe it did make people feel bad. Nobody
Right.
got punished for it. It was private. It was sent to the people's homes in an open discussion, because I have to tell you, and you know this, many doctors don't want to talk about obesity. It's literally the elephant in the room, no pun intended.
True.
We weren't
Yeah.
educated about it and how to
Yeah.
deal with it. And we have such a short amount of time with our patients that
Mm-hmm.
when you have to do for a pediatrician, I have to do a camp form, a school form, an allergy form, hearing test, vision test,
Right.
do your whole physical, find out about your school. And then I'm like, oh, by the way, how's your diet? You know, you have 3 minutes left.
Right.
So the BMI is just something fast. It's fast, and it gives us, now a good pediatrician might look at their patient who has a high BMI and see that they're a gymnast, because muscle is heavier. They weigh more. The kids who are muscular, they weigh more than the kids who are chubby sometimes. And I tell the parents that, think about a pot of chicken soup. You cook it, you put it in the fridge, you go to the refrigerator the next morning. The fat is at the top and the muscle is at the bottom. So
Right.
your kid might have a high BMI, your child might have a high BMI, but really not be obese. But it opened that discussion for me just to make sure, you know?
Right.
So
Exactly. No, and that's helpful. And I think some things that people don't realize, or something that, you know, I'll hear, at least with adults, I would imagine with children, you may hear similar things, is that a lot of people will talk about, well, it's genetic. So like everyone in my family is big, or everyone in my family is big boned,
right.
or everyone in my family is yada, yada, yada. And I think what people fail to realize is the role that nutrition plays, because parents tend to feed their children the same things or similar things, right, that they eat. And sometimes that's passed on from generation to generation. And so what I think your genes have in common is that your body will respond to nutrition in a similar manner. So if, you're really carbohydrate intolerant, or if you're really blah, blah, blah,
Yeah.
with you eating certain things, yeah, your children may manifest the same symptoms that you do. But I don't know if you want to touch on genetic causes, but at least from what I remember studying for the boards or just from medical school, there are very few genetic causes of obesity, true genetic causes that would cause an actual issue.
Correct. So the most of the genetic causes of obesity are picked up very young because those children have other problems, either whether it's immune problems, cardiac problems, intellectual, intellectual disabilities. They're often picked up. They often have phenotypes, like they might be very, very blonde or have very red hair and very pale and have pigmentation issues because it's a melanocortin 4 receptor, so it has other melanin defects. But I have to tell you, my career, I've never had somebody referred to me for obesity clinic with an undiagnosed genetic problem, ever. Because those children are often very short. They're very short and very obese. So they're like, they might be 3rd or 5th percentile for height and 95th percentile for weight. Whereas the obese child will be in the 90s for height and weight, or in the 70s for height and the 90s, or off the chart for weight. So I've never had a patient in 20 years with an abnormal thyroid test. And the parents get upset when I say that. And I said, that is good. That is such good news, because you don't want your child to have metabolic problems. Yeah. I said, this is all reversible. This is the best news you could have.
Right.
And I said, I try to focus on the positive. Like, this is all, like, even if a patient has pre-diabetes or fatty liver from their complications already from their weight, I love to focus on the positive. This is reversible. You made the first step. You brought your child here. We're going to be a team. We're going to work together. Rome wasn't built in a day. It's going to take time. It's not like those magazines where you see a before and after picture in like 6 months. Right. I never promised they're going to fit into a prom dress if they come in January, because that's not my goal. My goal is not to make somebody skinny and to make them look a certain way. I want you to be healthy on the inside. And that's where, like you were saying, how certain families are big boned. I'm never going to be able to change that. You're never going to be able to change that, but we can make them the healthiest they can be in their body. And that's really what I focus on.
Right. No, and I think that's a good point. And, you know, I think too, at least, so when it's the adult population, I think most adults recognize, whether it's a sense of urgency or not, but recognize as an adult, if you are obese, in terms of, you know, not healthy internally, and then also having symptoms of obesity, that's going to place you at increased risk for high blood pressure, diabetes, you know, premature death from cardiovascular disease, all of these different things, right? But I feel like sometimes people don't necessarily recognize what the complications of childhood obesity can be. Can you speak a little more about as to why it is important for children, like you said, to be the healthiest that they can be in their bodies?
Sure. So first of all, just like you were saying, so we know that 75% of obese adolescents are going to be obese adults. So, you know, a lot of those parents have that idea of baby fat, and they're going to work it off later when they get older. They're going to change their habits. It's not true. That's just not true.
Right.
So we really want to, my best referrals are the kids who are referred at 6 years old, 7 years old. Like when I get, like we were talking earlier, when I get a 17 or 18-year-old, that is a hard project for me. I have to undo 17 years of bad habits.
Yes.
Here when the family's on board, you know, it's so we see children worsening asthma because of their weight, joint pain because of their weight, foot problems because of their, you know, the flat feet, and they have to get inner soles. We have kids who have intellectual disabilities and problems in school because they're falling asleep from sleep apnea. Because not only is their body obese, their tonsils become hypertrophied, and they lay back, and these tonsils close their airway. They actually kiss, you know, they touch each other, and the child's not oxygenating well. We send these children for sleep studies, and they're doing terribly. They often need CPAP like a 70-year-old, you know, adult. They keep their airways open so they could stay awake in school the next day. I actually had a patient who had a sleep study this week with severe sleep apnea, and he was actually reported by child services. The teachers reported the mother to child services because they tried to help this family get their child to lose weight. They kept on seeing the child come in with junk food every single day, gaining weight exponentially. And actually the public school system reported the family. And now this kid is getting all the help he needs, and he's getting fitted for a CPAP mask. But he's 11. He's 11. I had another patient today whose family is like Indian descent. Lovely, lovely family. Grandmother's raising the kids. They eat healthy because they eat a lot of lentils, and they're vegetarian. So people often think that vegetarians can't be obese, but they can.
Yes.
They're eating bread, a lot of white rice. And the girl's 11 and a half, and she has fatty liver. And she just got a sonogram back with fatty liver. And I think fatty liver, right, is the second most common cause of cirrhosis after alcoholism.
Yeah.
So in adults, but we see it in kids. I had to refer her to a liver specialist today, and the mother was crying on the phone, but she was crying tears of joy because she said, I've been going to a pediatrician all the time, and nobody told me about this. And I'm so happy we found you. Like, she was sad, of course, and she knows it's reversible, but this is about having the conversation with your patients. And as parents, you have to be such great advocates for your kid and say, if you are worried about your child's nutrition status, say it to the doctor and say, can we discuss? And if you don't have time on your well visit, come in for a sick visit. Say, can we discuss my child's nutrition? I don't know if I'm making the right choices, and I want to go over it with you, because that is your right as a parent,
Well, and I think you make a good point too for the parents, but we also had a few physicians that logged in too. And I think a lot of times we don't think about bringing someone back for specifically to talk about obesity. So it's like you have your wellness, your annual, especially like in, I'll go from the OBGYN realm, but we have our annual. And so by the time you do the breast exam, the pap smear, and all those things,
your time is up.
You may have, like you said, 2 or 3 minutes left, and you certainly in 2 or 3 minutes cannot discuss nutrition status. The other thing too is when you ask parents to kind of recall what they're eating, what I find, if at least when I first see someone for an obesity kind of medicine consult, we talk, we get a feel kind of everything that's going on, but then I also send them away and have them come back in a week or two after actually tracking their meals in my fitness pal, because I said, I have no, and they can't tell you. I said, do you even have any idea of what percentage carbs, protein, and fat make up your diet? Do you have any estimate? Because someone is saying, well, I might eat 2,000 calories a day. I'm like, okay, but that tells me nothing about the quality of the calories. Exactly. And so I think doing that's an excellent point about bringing people back for a sick visit. And for patients, if you are not necessarily patients, patients or people listening, even though you're not our patients, if you have a question and you want to get into more detail, realize that, you may have to come back for a second visit because all of that can't be done in a 30-minute time slot.
It's just 15. Yeah. And also a lot of times a good way to bring people back. Well, I love the food diary. And for kids who don't use like MyFitnessPal, because a lot of our patients don't have that access. Make me a notebook. I want to see pretty stickers on it. You could decorate it. If you can't write it, your grandma could write it for you. And like, I make a big deal out of the food diary. Like, I am so proud of this food diary. I know how, it's like homework, and I try to I always have prizes in my office, and I give them a prize, some kind of squishy or stickers or toys. But I try to really reward them for that, because it is a commitment. It's when you think about writing down everything you eat, and then all of a sudden you're like, wow, I'm really eating a lot. And then they didn't realize it until they were writing it down. That's number one. Number two, I want to get fasting labs on a lot of these patients. So that's a good way to get them back, because I want them to come back with fasting labs, and I want to discuss the lab results. So, sometimes until we get an abnormal lab, the parents don't realize that the obesity is really, or the weight is really causing a problem. Or, high blood pressure is a very late finding in children. So I know you see it much more in adults, but if I find high blood pressure, it's not great. It's very late in the illness. But things like finding skin changes on children in the physical exam, which is like the dark skin, it's a velvety in texture, and sometimes there are skin tags associated with it. You find it in the underarms, in the groin. So I might show that to the parents, and they'll say, but I've had that, my child's had that for years, and the doctor never said anything. And like I said, your doctor's not an obesity medicine specialist. They've got a lot on their plate. This is why you're here to see me. Doesn't mean you're a bad doctor. This is just a conversation starter. Also, just like stretch marks, rapid rapid weight gain at certain times in their life for kids. Like boys coming in with like these red marks on their flanks because they're gaining so much weight so rapidly, you know, eating the dollar menu wherever they go, the fast food. I mean, drinking their calories. Some kids don't realize, especially for our teenagers, is that, so we have tons of access to food in New York City. I know you live in a different the Midwest, but our kids walk to school, walk home from school. I mean, my children and I pass 5 Dunkin' Donuts to go to school. 5 in like a 5-block, you know, and every time my kids will say, can I get a donut? Can I get a donut? And I'll say, no, you can't get a donut. You already had, no, you can't get a donut.
Right.
It's just like this constant bombardment. Kids come out of school, the ice cream truck is there, or the icy man is there. And I always say, like, we say no because we love you. It would be much easier to say yes. Like,
it would be.
Yeah. Because the kids, you know, come in my office and they're so mad at their parents and they're not talking to me. And I say, it's so great that your parents are here because they love you. They're here because they love you. No parent wants to say no all day. It is really not fun for us, you know?
Correct.
And then I try to get them to make 1 or 2 changes, really simple changes. When they feel they'd accomplished one goal, like stopping soda and sugary drinks, stopping, you know, the ice cream man on the way home from school, stopping the second slice of pizza, and they can do it and they accomplish these small goals, then it becomes more of a reachable goal for a lot of the children.
Mm-hmm. And then how do you kind of recommend, or how do you see practical ways for parents? So we touched on some of them, like decreasing juices and sugary beverages, but trying to incorporate more vegetables and fruits, because I think a lot of people still do a lot of the convenience foods, the packaged foods. And I mean, are there any practical tips, especially if you have a child that's like, I don't like broccoli, you know, I'm not gonna eat.
Everybody knows my favorite vegetable is cauliflower because it's white, right? So as a pediatrician, cauliflower is great because it's white. You can mash it into mashed potatoes and make it half, even a third potatoes, you know, 2/3 cauliflower. You can make cauliflower pizza crust. You can make cauliflower rice. Because when the kids see the green, they don't like.
Yeah.
Sorry, my phone. If they see the white, they sometimes are okay with it. Doing sneaky things like putting vegetables in your eggs, shredding zucchini and carrots into a turkey meatball, things that kids don't necessarily see because they can't pick it out. I'm also I love soup, and my kids eat a lot of soup. So like bean-based soup, like black bean soup, lentil soup, minestrone soup. Even Amy's Organic makes an alphabet soup for kids. Well, it's not for kids, for anybody. Oh. And so it's a vegetable-based soup, but it has all the alphabets and numbers, so it's fun for the kids to eat. Making food fun, cutting a turkey sandwich on whole wheat bread and hummus into a shape of a star, putting everything on a stick. Kids love everything on a stick. So make it a chicken lollipop. Make it, you know, 4th of July is coming up. So I always say, if you're invited to a barbecue, why don't you make the healthy dessert? Make fruit kebabs. So like I'll say, you know, like you see it on Pinterest. I'm not like the best baker or cook, but like you can make these fruit kebabs with like a blueberry, a strawberry, and a little mini marshmallow. So it's red, white, and blue. It's fun for the holiday, but they're not getting tons of sugar. Like if you know that your family's invited somewhere for a big party or a gathering, why don't you make the healthy dish so you know that your family has something to eat? Make the salad, make the fish, make the beans. Very cultural. I love food, and I'm a foodie, and I think that's why I love my job. But I love to take like recipes that people have and try to make them healthier. So like, okay, your grandmother makes you rice and beans and she's using pork lard. Let's figure out how we can make the rice and beans taste delicious with great herbs and cut out the pork lard, you know, things like that. So.
Right. No, and I think just in terms of practical ways to start, it's that, you know, cut out that juice. You know, the example you gave earlier about seeing the 2-year-old drinking apple juice from a bottle, like those just aren't things, right, that kids should be drinking. It's not to shame anyone or anything like that, but I mean, it's just that a level of sugar. A lot of people fall into the trap thinking that juice is healthier than pop or soda, and it really isn't. I mean, if you look at gram for gram, a lot of times the juice has just as much sugar as if you would have given them a Coke. So you have to kind of get your child used to drinking water. Other things are, if you are going to, on occasion, let them have juice, Not that I guess this is recommended anywhere, but what we used to do for our kids is we diluted the juice.
Oh, definitely. Yeah.
Dilute it. And so it was like, okay, you know, here's your apple juice, but it's half a cup of water, half a cup of apple juice. And so to get them not used to having that super sweet, you know, kind of taste. So,
well, I find a big problem that I also have is that this like juicing is popular, or making like a vegetable juice. So the parents will be like, oh, don't worry, I get them to eat their greens, I put it in a juice. So I'll often say, tell me what you put into your juice. And they'll say, oh, I put pineapple, kale, apple, banana, mango. And I'll say, but think about how much fruit you put in there, right? That's like a huge fruit salad, but you mushed it all into a glass, and you're basically just giving them the water and the sugar, and you've gotten, all the fiber is gone. So I want your kid to eat the fruit. I want your kid to eat a tangerine in the morning, or a clementine, or a half a banana, you know, because my friend Stephen Cook at Rochester, he's also a pediatric obesity specialist. He always says, like, digestion starts in the mouth, and you have to remember that. And when you give the kids those, you know, green juices or whatever, they're not digesting anything because it's already sugar and water.
Yeah.
You know,
and it's just straight to their system. And I had this conversation. It was funny with one of my friends yesterday. We were getting into a debate about smoothies, even though it's not necessarily, there's more fiber in it than juicing. But I said, in a smoothie, someone may put like 3 or 4 bananas. They may put like, you know, 3 oranges, 2 cups of strawberries, like whatever. And I'm like, you would not have eaten that amount of fruit in the whole day. There's no way. There's no way that I'm going to eat 4 bananas one day, 3 apples. Like I couldn't do it even if I tried, but yet you have just given yourself that. And so I think, again, it's just this concept that we really shouldn't be getting the majority of our nutrients from things that we drink. And I know people love their recovery shakes and their protein. We should be eating these things, because when we have to eat them, your body over time will regulate your intake, because there's just, you can only eat so much, you know, X amount in a day. If you're eating it in its whole form, your body, you're not going to eat, you know, 10 pounds of broccoli.
Right. And then I think with a lot of our patients, they're like a meat and potatoes kind of family. So they don't see it. It's not junk food, right, per se, but my patients might be eating like red meat, like 2 or 3 nights a week with big hearty baked potato or roasted potatoes, you know, and I'll say, well, let's cut back the red meat to like once every 2 weeks, and we'll do lean proteins, try tofu, try chicken, fish, you know, and oh, I hate fish. And like, oh, I have to tell you, I used to run a program at the YMCA where every week we'd make a healthy meal with the kids. It was an obesity medicine program. And my favorite saying was like, your yuck is somebody else's yum. So I don't want any kids saying yuck in here, because it really ruins the experience for somebody else eating. But I also have to tell you that anything we made, there was never any leftovers. You have to expose them to new things. Like, oh, he doesn't eat fish. Oh, she'll never eat a vegetable. Well, what can we motivate them to eat a vegetable? Do you want a new app for your phone, or do you want $1 for Fortnite, or do you want a new book, or do you want a tattoo, or do you want your nails done? Like, everybody has something. And I mean, I know you don't do this in adult medicine, but bribery works really well in pediatrics. So if you eat, like I always say to my patients, I want you to eat 1 new vegetable a week or fruit, and you can't spit it out. You cannot chew it and spit it on the table. You can't ruin the experience for everybody else at the table. But if you eat 3 new vegetables in a week, weekly, your mom will get you this. You'll get a new pair of shorts. You'll get a new something, not something crazy because the parents go broke, but something that they have a goal for, you know, or maybe even be just like spending time with your dad or something, you know, as easy as that. We'll go shoot with you. So it's really about small changes, and you have to like really encourage the parents, because it's mentally exhausting for the parents. So they need a lot of support, because they're just tired and they don't want to deal with the tantrum and the fight, you know. So it's just like a lot of supporting them.
Right. And I'd like to, it was I think in one of the Pete the Cat books, our kids are big into Pete the Cat, but where they talked about the 3-bite rule. And it was like, before you decide you don't like it, whatever this new food is, you have to take 3 bites, 3 separate bites. And a lot of I find by the time they get to, I mean, obviously there are going to be some foods that kids don't like. I mean, there's some foods that I'm like, yeah, I've tried that, and I don't like it. So that true, but it's at least getting them to try it. And so, and a lot of times, like you said, you can just get past the yuck when they're looking at it and then they actually try it. People end up liking it a lot. So no, I think those are all really good practical tips. And I think just for people to realize is that nutrition really does start at home. You're not being the renegade parent. Like, don't feel like you're depriving your child because you are choosing to cut down on juice and, you know, processed foods or things like that. What I always tell people when they kind of look at like what my kids eat, I'm like, you know, I don't have to worry about sugar finding them. I'm going to send them out to the world. They're going to go to a birthday party. At the birthday party, not like, oh, they can't have the cake. Yeah, you know what? Because we don't go to a birthday party every day. So yes, at the birthday party, have the cake and ice cream, you know, that. But then I'm not necessarily going to stock a plethora of high sugar foods in my house because when they do want to indulge in special occasions, they understand like, yeah, we can have stuff on special occasions, but this should not be what I eat every day. And, you know, you can do, meals don't have to be elaborate. I think you made a point before where you're saying, you know, sometimes people don't even realize like a snack could be scrambled eggs. You know, you don't have to eat scrambled eggs at breakfast.
My favorite thing I say to my patients all the time, and they probably hate me for it. I said, not every meal is not a party. Like, you know, like when I'm talking, I see the patients like rolling their eyes, you know, making faces, like, and I said, you know, your mom's not like a gourmet chef. Every meal can't be a party. Every meal I eat, I don't love every meal I eat, but you know, you need food to live and you need healthy nutrition. And then when you get something you like that's healthy, we can go and we can expand our palate. And I always tell them, you're not enjoying healthy food because you're so limited to what you're trying that you didn't let anybody make it taste delicious because they don't want this on it. They don't want that on it, you know? And I think something I don't know if I touched it with you is about the portion sizes. A lot of families are eating healthy, but they're eating the wrong portion. So I have patients that, especially in Manhattan, we have a lot of parents who are much older and they're not around children a lot. And they have maybe one child and parents are older and they're not child savvy and they're serving them the same portions that the adults eat. So when I'm just saying, I say simple things like, do they eat dinner on a child plate? They're like, what do you mean child plate? I'll say like a salad plate or even smaller. They're like, no, because they weren't feeding them healthy, but it was like quadruple the amount of food that they were needing per meal. So it's about portion sizes. And honestly, in my office, I keep portion sizes. So I keep a sample plate, a sample cereal bowl, because they might have a bowl of cereal, but their bowl is filled up double of what it really should be and what 1 cup of milk in the cereal should be. Or, you know, the size of the macaroni and cheese that they give them shouldn't be like overflowing the whole plate. It should be like a quarter of the plate, and the protein and a vegetable should be on the plate. So we do a lot of, I do a lot of teaching with visuals because I think parents just need to see it. You know, it's just like eye-opening for them.
Right. And I think that's a good point too. And we've shown, just different media things or whatnot, that the portion sizes have just changed drastically. Do you know what I mean? Over the years, in terms of now everything is supersized, everything's a double, everything's a, you know, whatever. Someone will look and like, oh, that's all you're going to eat, you know, and it may be an actual normal size, whatever. And so I think that's some of it as well, is that adults especially have this skewed idea of what portion sizes are, and then we're feeding our children with these skewed ideas of how much they should eat. Intuitive eating. So obviously we don't recommend intermittent fasting in children in the traditional sense and what other patients may, or not patients, but what other people may think of. But in terms of just, you know, cutting out nighttime eating, you know, those things are huge. And so I think we're always wanting to put a label on something, but as we learn more about, or not, I guess, as we learn more about the circadian rhythm, but it's always been there. We've known about it. We just have kind of ignored it. Nighttime eating after dark was just not something that our bodies were designed to do. So, you know, you're not starving your child because you're telling them they can't eat at 9 and 10 o'clock anymore.
Right.
You know, I mean, for a lot of children, 8 o'clock is a perfect goal to set as bedtime for the sleep requirements that they're supposed to get.
And
So
we know this. We know that if they stop eating at 8 o'clock, they'll sleep more. They're going to be thinner because they're not going to be eating all their calories. And I explain to them, and this is very also very important with children who are on ADD meds. So the children who are on ADD meds, which is like a very high percentage now, their appetite is suppressed the whole day, and then they eat from like 4 o'clock on. Like the stimulant wears off, and they just become crazy eaters. And so in the past, we always used to think, oh, the child on a stimulant is very thin because they're not eating the whole day. Now we see that they do drop in weight, but they actually pick up, and then they actually exceed their peers who are not medicated in weight.
That's interesting.
More obese because they're eating all their calories after 4 p.m. Sometimes until the evening, well until the midnight. So it's really important about like discussing that with their doctor who's managing their ADD meds. But their appetite can't be suppressed for so long because these kids have to eat a little bit of a lunch and a dinner because otherwise their medicine is off and they're like going bananas at 8 o'clock.
They're
pulling
like
everything out.
Yeah, because they didn't eat all day.
And I just explained to them, I said, listen, your body, you're walking around all day, even if you're not exercising per se, this is just normal movement. When you eat at 8 o'clock at night and you go to bed, all that food is just sitting there on you. You're not burning that off. And then it's just with teenagers, especially you see it with adults, they don't eat breakfast because they're not hungry because they ate all their calories at midnight,
Yeah. And then they get disordered, you know what I mean, eating from that. It's a vicious cycle. So I think there are so many things. I mean, it may seem overwhelming for a lot of people, but what would be your takeaways? Like if you had to think of maybe 3 or 4 takeaways that someone who had a child that was either overweight or obese could do, just simple lifestyle changes, kind of to wrap it up, what would be not easy, but I guess what are the most practical things people could start with to try to impact their child's health?
Oh, sorry, I just had to charge my phone. So I would say, one, keep a food diary the first time. If you're concerned about what your child's eating, keep a food diary and go to your physician, nurse practitioner, family doctor, and show your doctor a food diary and say, can we have a discussion? I'm a little bit concerned. And it doesn't mean that your child has to be overweight. It just might be that your child's eating the wrong food. And sometimes until you write it down and you get that good history, you don't really know what your child's eating. So your teenager might be going out and getting sugary drinks without you. They have babysitting money. They have a side job. They're kids. They get money from their grandparents. You might not even know about all the candy, the wrappers that you find in their book bag. Where are they getting that food from? So do a good history about what your child's eating. 2, find out. If you don't know it, ask your pediatrician, ask your doctor. What is a portion size for a toddler? What is a portion size for a 5-year-old? What are the calorie requirements for? Calorie requirements change as they grow. So what are the calorie requirements for an infant? When do I start solid foods? Because we know that introducing solids too early also leads to obesity. What are the benefits of breastfeeding versus bottle feeding? So starting a healthy nutrition conversation from really early, and you're in maternal fetal medicine, healthy moms, healthy children. We want them on the same page, right? Mm-hmm. So the conversation has to start early. And then you shouldn't be ashamed. If you need help and you say, I want to change for my family, I want my child to be healthier. And what I often see is that the whole family eats healthier and loses weight together. And even if there's often one child who's overweight and the other child isn't. And what I tell the family is, I do not want this child to eat differently than the rest of you. Mm-hmm. Everybody has to eat the same. Because that is really stigmatizing and they feel that they're different than their siblings. True. And we want to healthy together because like as we were saying, the most common problem in health in children who are overweight and obese is mental health, that they're very depressed and very anxious about their weight. So then if you put them at a dinner table and you give one kid fried rice or French fries and then you have green beans and a piece of fish, everybody should be eating the green beans and a piece of fish. That's how I want it.
Yes. And then the other thing too, I think, and we're learning more about this, but in terms of trying to help people be their healthiest self, a lot of people sometimes only feel the need to address their nutrition and cut down on the processed food and the sugar and all the junk if they have a weight issue. So you can have other issues from childhood through adults, even if your weight is normal, because of the food that you're eating, some of the rises that we're seeing today in child allergies. I mean, I was just talking with a friend, you know, in terms of, I feel like at my son's school, there's like every other person might have a peanut allergy. When I was in elementary school, there just nobody had any allergies. I mean, I'm sure somebody did, but I don't know who that was. So who had the allergies? And so I think we just have to be cautious that while obesity ends up sometimes being a late symptom of an unhealthy diet, that there are other reasons to cut these things out for your children, even if they are slender. Because eventually the health aspects will catch up, and it may not manifest as obesity. It may manifest as something else.
Absolutely. Even like just something as easy as dental caries, like cavities, you know, so they might be thin, but have terrible teeth from all the sugar that they're consuming. So, you know, I tell the parents that this is an example of that the diet has to change, you know, and just because that other child is thin doesn't mean that other child is more healthy. I always tell the kids, just like you might have brown hair and your sister has blonde hair, you might be dark skinned and your sister's light skinned. Everybody has different genes. You're not the same kid, but you live in the same household, and we all have to eat the same way, because eating healthy is good for everybody, you know? So
it's not just for the one who you perceive may have a problem with weight. Healthy eating is beneficial for everyone. So we've been getting a lot of comments on people saying that they just love the information that you've been sharing. And lots of thank yous as I'm scrolling back through. So I really appreciate you taking the time out tonight to talk with us. If I didn't say it earlier, just so people are aware, we're talking in general sense. So obviously neither of us are your physicians. So if you have heard anything that you want to try to integrate into your life or your family's life, definitely have a conversation, reach out to your care provider, schedule a visit just to talk about nutrition. If they don't have time, maybe they can have you talk with a nutritionist or a dietitian or something like that. But definitely reach out. We did, as I say that as I'm wrapping up, and then this will be the last question, I'll let everybody go, but someone just asked, so Holly214 asked, is it important to push protein or just whole foods? What's kind of your take on that?
Well, we need protein because they need energy to build muscle, and protein is very important as part of the diet. So it's what proteins we're pushing. So we want them to have lean, healthy meats like chicken. If they do eat meat, chicken, fish. Tofu is also a good source of protein. Peanut butter, eggs, milk. So it depends. You have to work with the family and what they're eating. There's protein in different types of vegetarian burgers that you can give kids, or patties. Some kids need supplements if they're on a vegetarian or a vegan diet. But for the most part, yes, we want the kids to have healthy proteins, but we don't want it to be like only pork or only red meat or, you know, fried food. We want it to come from healthy sources. Whole foods are great, so we want them to have, you know, least processed food as possible. It does become more expensive, but you can get frozen vegetables. You can buy canned soups for your kids. You can buy beans. You can buy in bulk, so it costs less. There's so many options out there. Peanut butter, almond butter. You just have to remember to buy it like with no sugar added, natural peanut butters, things like that. The hummus is a great source, edamame, the soybeans, the kids like to eat those, and they have protein. So you just, you can look on the internet, good sources of lean proteins for kids, or you could ask your doctor. You can also look at, we're both part of the American Board of Obesity Medicine. You can go to their website and see if there's a doctor who specializes like we do in your area. You could call them and they can refer you to somebody. But most hospitals have a nutritionist on staff. Most local medical centers know somebody, community center, and sometimes you just need the YMCA. They might have it. So you have to reach out in your community and find somebody, and usually community leaders network, so they'll know somebody who can help you. And that's really, really important. And sometimes, like I say, ask the lunch lady. Like, ask the lunch lady, is my child eating 2 meals? Because they're not allowed to tell kids in public school not to take a second meal often.
Oh, I didn't know that.
Yeah.
Okay.
Yes. They're not allowed to in a lot of schools. So you have to do detective work. Like, I don't know where my kid is getting all these calories from. And they'll say, oh, your kid always goes up for like 2 chocolate milks or something. So then you have to, explain to your 6-year-old, like, it's 1 chocolate milk at lunch. So it's a lot of detective work. It's a lot of, time to do that research on the parent part.
Yeah, no, that's a good point. And about the kids getting extra meals, I remember when when my husband and I stopped having our children eat school lunch, because they made it very convenient. Like, you could just preload an account, with money. You didn't have to think about it. You sent them to school. They had their lunch, and then they came home, and then we started looking at the lunch. And we're like, okay, yeah, we probably need to pack your lunch. So for the first, I think, 6 weeks, we were packing lunch. And then after that, I got an account balance, and they were like, your account balance is 0. And I'm like, wait, how is that possible?
Right.
We're sending you with lunch. And so we just asked our son, who's very sweet and innocent. And I was like, Michael, are you eating lunch at school still? Because we're packing your lunch every day. And he's like, oh yeah, I finish your lunch and then I go get the lunch.
Double dipping.
He's like, because I'm still hungry. And I was like, okay, so then I need to send you with more food. He was like,
right.
Oh yeah, you could send me with more food too. I'm like,
right.
Perfect. So then we sent him with more. And then, our account balance stopped being used at all. So luckily for us, we were able to track it, because I'm like, wait, how do we have like a low balance? You're not supposed to be doing that. But like, we had no idea. So I definitely can see how that parents may think their children are eating one thing, and then when they're out of sight, you really have to, like you said, do the detective work, or your school will send you notifications that your account's being used.
Balance is 0.
Yeah, your balance is 0. You owe the school district. Like, what? So that helped us. But no, I truly appreciate your time. For just so people are aware who are tuning in now as we're wrapping up, this chat conversation will replay in the stories for 24 hours. And then after 24 hours, I have an app that will save this recording. So I'll post it to my website, and then I'll send you a link as well, so that you'll have it. So people will have a chance to replay it if they Google it.
Right.
They'll be able to find, just general information about childhood obesity.
One other thing about protein, great source of protein that kids love is cheese. And I often just recommend, if they have a weight problem, I do recommend low-fat cheese. They can do cheese, but do low-fat, because most kids will eat something if it has melted cheese on it at some point. So broccoli with melted cheese, cauliflower with melted cheese. It might not be ideal, but it might be a way to introduce it.
True. It may be a good way for transition, especially if they went, like, I hate vegetables for whatever reason. So, like, how can we get you to incorporate it and slowly remove? So, that's a good point too. Yeah. Well, thank you so much for your time and for tuning in.
This was so fun.
Yeah. And I hope people, like I said, we tend to talk about more, like when I do Instagram live sessions, we usually obviously talk about adults, right? Because that's what I see. But what I'll notice is that sometimes we tend to cut out food for ourselves that we still allow our children to eat. Like, so, maybe I don't eat Reese's anymore, whatever. But then my child's like, oh, I want gummy bears. And so then you give your child gummy bears. And so sometimes I think there's a disconnect from, like, when adults are getting themselves healthy and not necessarily making that connection that the same foods that are healthy for you, if they're whole natural foods, are going to be healthy for your children. And so really to maybe make that lifestyle change together, rather than just in isolation for one person.
Yeah.
So, yes. Well, thank you very much. Everyone have a good night. Dr. Hes, you have a great night. Thank you for joining us. All right. Take care. Bye.